A heart attack can come suddenly, often without warning, and in those moments, every second truly matters. If you or someone near you ever feels heaviness, tightness, or pressure in the chest that spreads to the arm, neck, or jaw, don't panic, just act quickly and calmly. Sometimes seniors may not feel classic chest pain. Instead, they might experience unusual tiredness, shortness of breath, dizziness, or nausea. These can also be signs of a heart attack. The key is not to ignore any sudden discomfort or weakness. Stay calm and move to action immediately. The very first thing to do is call for emergency help. In the U.S., dial 911 or your local emergency number if you are in another country. Do not attempt to drive yourself to the hospital. If you're alone, try to unlock your door so rescuers can enter easily. Sit or lie down in a comfortable position with your back supported and your head slightly raised. Loosen tight clothing, especially around the neck and chest, and try to stay as calm as possible. If someone is with you, ask them to stay close, speak reassuringly, and avoid panic. Every minute you save increases your chances of recovery. While waiting for medical help, one of the most important actions that may save your life is taking aspirin, but only if your doctor has told you it's safe for you to use. Chew one regular aspirin, 325 milligrams, or 4 low-dose baby aspirins, 81 milligrams each. Chewing, not swallowing, helps the medicine work faster by thinning the blood and stopping the clot from getting bigger. However, if you have an allergy to aspirin or your doctor has advised you not to take it, do not take any. Always remember, this step is only for those who have been told previously by a healthcare professional that it's safe for you. If you already have heart disease and carry nitroglycerin prescribed by your doctor, use it right away as directed. Place 1 tablet or spray under your tongue and let it dissolve slowly. Do not swallow or chew it. If the chest pain doesn't ease within 5 minutes, you can take another, but never more than 3 doses within 15 minutes, unless your doctor has advised otherwise. Nitroglycerin can cause dizziness or a drop in blood pressure, so sit or lie down before using it. If pain continues even after using it, do not delay. Emergency medical care is the only next step. Avoid eating or drinking anything at this time. Your body needs to focus on maintaining blood flow, not digestion. Taking food or water may cause choking or slow emergency treatment later. Focus on calm, deep breathing. Slow inhales and gentle exhales can help reduce panic and pressure on your heart. If someone is with you, keep checking their breathing and pulse. If they lose consciousness, immediately begin CPR if you know how. If you don't, follow the operator's instructions on the phone. Emergency responders are trained to guide you step by step until professional help arrives. Those few minutes of steady action can make the difference between life and death. Once the person reaches the hospital, doctors will confirm a heart attack using ECG and blood tests. They may give clot-dissolving medicines or perform angioplasty to open blocked arteries. The first 90 minutes after symptoms start are called the golden hour. Acting within this time can save heart muscle, reduce complications, and increase survival dramatically. After the hospital treatment, the recovery phase begins, and this stage is just as important. Seniors must strictly follow their prescribed medication routine. Common medicines include blood thinners, beta blockers, ACE inhibitors, or statins, all of which help prevent future heart attacks. Take your medicine exactly as prescribed, at the same time every day. Don't skip doses or take double amounts if you forget. Carry a list of your medicines with you at all times. Monitor your blood pressure and sugar regularly because high blood pressure and diabetes can silently damage your arteries and increase the risk of another attack. Eat a heart-friendly diet with less salt, no fried or oily foods, and very limited sugar. Include fruits, vegetables, oatmeal, olive oil, nuts, and fish in your daily meals. Avoid red meat and processed foods, which are heavy on cholesterol. Eat small and light meals instead of heavy plates that strain your heart. Quitting smoking is one of the most powerful steps you can take after a heart attack. Even one cigarette narrows your arteries and reduces oxygen flow. Avoid alcohol too, as it can raise blood pressure and weaken your heart muscles. Within weeks of quitting, your blood pressure stabilizes and oxygen levels in your blood improve significantly. Start physical activity gradually. Begin with short, slow walks, light stretching, or simple breathing exercises. Cardiac rehabilitation programs are highly recommended for seniors, as they offer safe, supervised exercise plans. Never push yourself too hard too soon. Always check with your doctor before increasing activity. Managing stress is another vital part of heart recovery. Emotional stress releases hormones that can raise heart rate and tighten blood vessels. Simple practices like slow breathing, meditation, prayer, or listening to calm music can make a huge difference. Talking with family or joining a support group also helps reduce loneliness, which can silently affect heart health. Regular medical checkups are crucial. Even when you feel fine, your doctor can detect early warning signs that you might miss. Report any unusual fatigue, shortness of breath, or chest discomfort immediately. It's always safer to get checked early than to wait. Keep a small heart emergency kit at home and while traveling. It should include aspirin, nitroglycerin if prescribed, and a list of emergency contacts, including your doctor and local hospital. Keep this kit where it's easy to reach and make sure family members know where it is. Remember, surviving a heart attack is not the end, it's a second chance to live more carefully and more consciously. Life after a heart attack can still be full and beautiful if you stay disciplined, calm, and aware. With proper medication, healthy habits, emotional balance, and timely medical support, your heart can grow stronger every day. Take every heartbeat as a blessing and every precaution as a promise to yourself to live longer, live wiser, and live with peace. Your heart has already shown its strength. Now it's your turn to protect it.